Hi, I'm Dr. Patrick Fann, and I'd like to talk to you today about nasal and sinus surgery, including septoplasty, rhinoplasty, and endoscopic sinus surgery. Before we get started, however, I want to emphasize that not all these procedures are necessary for all patients, so you should thoroughly discuss with your surgeon which procedures are appropriate for your unique situation. The first of these, septoplasty, involves straightening of the middle wall of the nose, which is made of cartilage and bone. Oftentimes, ridges in the nose, called turbinates, are also reduced to further improve breathing. Rhinoplasty involves changing the appearance of the nose. Changes can be subtle, or they can be dramatic, depending on your specific goals. Sometimes rhinoplasty is done to correct a prior fracture. Occasionally, we do a rhinoplasty in conjunction with septoplasty to help correct a breathing problem. The nose is surrounded by sinuses, 4 on each side. Endoscopic sinus surgery is performed to clean the sinuses of chronic infection. The sinus openings are widened to help improve drainage of mucus, which helps to prevent infections in the future. Sometimes, if necessary, we also remove polyps or cysts as well. After your consultation, if we agree that you would benefit from surgery, our office will obtain insurance authorization before scheduling your surgery. I'll see you again about a week before the surgery date to make sure that you have a full understanding of the procedure, postoperative care, and recovery process. I'll also prescribe your post-op medications, order any labs that might be necessary, and make sure that all of your questions are answered so that you feel comfortable going into the surgery. You will need to stop taking aspirin and anti-inflammatory drugs such as Advil and ibuprofen, as well as vitamin E and fish oil 10 days before your surgery to help prevent bleeding. We ask that you not eat or drink after midnight the night before surgery to help prevent anesthetic complications. Nasal and sinus surgery can almost always be performed on an outpatient basis, which means that most patients, except those with sleep apnea syndrome, can go home soon after their surgery. You will need to arrange a ride home from a friend or family member. After surgery, most patients elect to take a week or so off from work, although you can usually work by phone or computer within a couple of days. Pain is usually mild. Most patients find that Tylenol is all they need, although we usually prescribe a stronger medication just in case you need it for a couple of days. You'll probably have some bloody drainage for a few days as well. However, this is often minimal after the first day. The recovery room staff will give you nasal dressings to take home with you as needed. The worst part of recovery is normally stuffiness and congestion, especially in the first week. After that, I'll remove the splints in the office, which will relieve most of the congestion. Septoplasty splints look like this. They might look surprisingly large, but after your surgery, there's plenty of room to accommodate the splints. Some patients having rhinoplasty surgery will also have splints which look like this. They're also removed a week after surgery. After the splints are out, you'll start using 2 kinds of nasal sprays to help with healing. The first is a prescription spray to help reduce swelling and help prevent scar formation. It contains a mild topical steroid, and I'll ask you to use 2 puffs in each nostril once or twice a day. The second is an over-the-counter saline spray. It keeps the nasal linings moist and helps to prevent crust formation. The brands I generally prefer are Air and Salinex. It's important to use 2 puffs in each nostril several times a day. When you use the sprays, this is the most effective method. Tip your head forward and aim the spray nozzle toward the back of your head, just below the level of your eyes. Press firmly and sniff sharply. Though the chances of developing an infection are low, we'll have you take an antibiotic for a while to help minimize this risk. You should avoid nose blowing and physical exertion for about 2 weeks after surgery. Surgery is a team effort. The team consists of your surgeon, the medical staff, and you, the patient. You should always feel free to ask all the questions you need so you fully understand the surgery, and to help ensure a quick recovery and successful results.